Hey guys, welcome to the Pregnant Christian Environmentalist podcast. I am here with my sister, Sarah. Say hi, Sarah.
Hi!
I'm excited to have her back on. She's in the second episode, and we are going to be talking about... Last episode was just updates and fun. Now we're really gonna get into the thick of things once again. We're gonna talk about basically all the injections, all of the vitamins, whatever might be happening during labor and your baby might be injected with at the hospital or even at a home birth. We just got a little list going. At first, I had no fear to make this because I'm so casual on this podcast. I just want to chat and share my brain, what I've been learning from different resources. But then I was starting to get a little grounded and realize this is a very touchy subject. Some of them, not all of them. So I actually do want to keep it very just factual and not biased, especially because some of the subjects at the end will go into a little bit about the vaccines that babies will receive. They're very divisive. We all know that. And so I just want to be factual, and there's no reason to make anybody emotional. I just really believe, me and Sarah were talking about this a lot, we just want people to know what's in everything and know also that it's all an option, because a lot of moms don't know that. For example, I just learned about what GBS is and how if I tested positive for GBS towards birth, we'll get into this, I would be suggested antibiotics, and I probably would have said yes before doing research because that sounds scary. It's group B strep. Oh my gosh, I have strep down there. My baby's gonna wipe against it. That sounds really dangerous. And I would have just said yes. Now I did some research and I might make a different decision. And I know that if you just go to a doctor, they're not going to tell you this is an option. They're just going to say, just do it. It'll save your baby's life, So we want to talk about the fact that that's not necessarily true with some of these. It's not all necessary, and there could be some negative effects. So that was a bit of an intro, but Sarah, will you once again introduce yourself a little bit? I talk about you a lot, just how it's really cool that you're in the medical field. You now even work, I believe, I'll let you say that, with kids, but say your specific job. And you also have done so much research personally on holistic sides of things, and you're just super well-rounded. So why don't you maybe explain yourself a little bit?
Okay, my name is Sarah. I am Rosalie's older sister. I'm a nurse. I've been a nurse for 7 years. I have worked in a variety of different places, but I do currently work at the Regional Children's Hospital on the Rapid Treatment Unit. So yes, I am specifically working in pediatrics, which I love. It's the best. Go kids. And I, as Rosie said, have some natural health leanings, despite being in the medical world, because that's I'm definitely a minority, but just through my life experience, through trying to deal with personal health issues and also with our family members who have gone through health issues and how they've chosen to treat things naturally, just given us, I think all of us kids, a wide perspective on both sides of things. And it's why I think it is so important that everyone sees, gets informed consent, which is the medical term for everyone knows, what's happening, what are the side effects, what are the risks, is the risks outweigh the benefits, and, you should know all these things, because no medical intervention is perfect and doesn't have any side effects, but sometimes, and a lot of the time, they're worth it, but we should know. We should be able to make informed decisions before, especially on our little newborn babies who are just fresh to the world and maybe don't need all these interventions that they're being pushed on them, because they're just innocent little things fresh to the world. But yeah, so let's get into things.
Yeah, sweet. I will, with each subject we're going to go through, I'll let you guys know if I've researched it or not, because not every one I have, but Sarah has, and I just want to be honest with that, because the few that I have, I feel like I do have something to share with maybe someone that's interested and is facing this decision, because I did a lot of research. I tried to look at both sides and all that, but some of them I'm like, clueless. Sarah's gonna have to teach me here. Haven't gotten into that lately, but one more just note, kind of repeating myself. Most of these, yes, if you don't necessarily see a natural midwife or take a more naturally minded birth course or read those kind of books, you most likely will just be presented these not even as options, just as here you go, just do it. Like you'll probably just be given it and not even realize it is an option. So repeating that again, and then what I would do with this information, I'm going to add in the show notes a lot of my favorite podcasts on these things. But if something's really a big decision to you, I mean, these are all actually what we're going to talk about are going to be decisions for you if you're pregnant. And if something is really just confusing you, I'm just putting it out there, like definitely do your own research and look into both sides. From what I've noticed lately, the expecting mothers I know and have been doing their research just start to get way more confused on why these are so normalized. So basically, just do the research, is what we're saying. One other thing I like to say is, have we ever heard of anyone that decided to just deep dive research into all of these specific topics, decided, you know what, I'm going to look at all the history, all the resources that I can find, and deep dive into both sides, and then come out just fully trusting the system after and saying, actually, I do trust everything that I'm told by the government and doctors? Like, no. And another thing I've noticed is I have never heard of anybody, like, I all the time am seeing people go from antibiotics are amazing, go injections, whatever the doctor says, I trust, to the other side. Holy crap, gotta question everything. Actually, this is upsetting. Actually, we are not told enough side effects. Like, plenty of that is me, that is many people that I know and see online and read about. I've never heard of anyone going the other way. Like, this to that. Like, oh, I don't trust anyone, and actually I do now trust all the doctors and every antibiotic they want me to take and vaccine and injection and give my baby. Like, that just doesn't happen. I've never seen that. And it just kind of goes to show, like, the more you research, the more you find things out. The system is pretty messed up. So that just speaks really loudly to me. I don't know about you. So let's start with Pitocin. I hear so much about Pitocin. It is to be induced in labor, and I'll just say briefly what I've learned personally. Yeah, this is definitely talked about a lot more. I did look it up. It is just oxytocin with, it was some long word that Sarah told me, is just with saline, so
There you
there's
go.
no scary other ingredients. It is a hormone. A big reason a more naturally leaning birth would say avoid it unless necessary is because it definitely makes contractions more painful. It can make you go from 0 to 100 really fast with your contractions versus letting your body do the natural thing it wants to do, slowly working your way up towards the more difficult contractions that are, like, with each one, it's working your muscles, making them stronger. It's this long, beautiful process. Unless you're a speedster, is what they call them, then maybe your body doesn't need as long as some others. But for those that need a long process in labor, that's on purpose. And so try not to induce to make it go faster because your body didn't do what it wanted to do. That's about what I've learned. If you hear about the cascade of interventions, it's like normally the first thing that happens, and like the stats say you're this much more likely to get an epidural after that because it makes it so painful. But I have met a lot of moms that got Pitocin and did not get an epidural. But yeah, normally it leads to an epidural. That's about what I know. Sarah, what do you know about Pitocin and anything on top of that?
Not really. That's the basics. That's one of the
Yeah,
things. Yeah, it's just,
simple.
it is what it is. A lot used to induce labor and to, if they're feeling like it's taking too long, then they'll use it. Sometimes it's necessary, but
Yeah. Yeah, it can
other
be necessary.
but other times it's not, and you might, choose to just, like you said, do things more naturally, let the body choose the speed, which is always better if possible.
Yes, and a lot of home birth midwives, will carry Pitocin because it actually is handy for if you are bleeding a lot after birth too. So that was
Mm-hmm.
interesting.
Mm-hmm.
Because, yeah, it simply is just a hormone. So not too scary, but what it can lead to, not as good. So that's it on Pitocin. Let's go on to epidural. And I was asking Sarah, okay, what about other pain meds? How does that work? So I actually have not researched what even is an epidural. I know what it is, but what are you being injected with? How does it work? I don't know the details, which obviously I want a natural birth. You all know that, but you never know if I might be presented that as like this could save your life right now or whatever. So we want to do our research. Sarah, could you talk about the epidural, and then you could add in what you were explaining to me about opioids and other forms of pain control?
Yeah, sure. So an epidural, I mean, I think most people know it's a nice big needle they put in your back,
Mm-hmm.
into your through your spine to into your spinal fluid, and then they inject medication into the spinal fluid through there. They will use what's in the epidural is a local anesthetic. So you've probably heard of lidocaine or novocaine. They'll use those to like numb your mouth or things like that. Well, it's in the same family of that, another local anesthetic, and then that's mixed with an opioid. So either fentanyl or hydromorphone or Dilaudid, they call it. So those are what's in an epidural, what they're actually injecting into you. So it most of it stays in that epidural space. It doesn't go into your bloodstream for the most part. So the benefit of that is that it's not, most of those medications are not making it to your baby. You don't want to be drugging your baby if possible. So if you were to have an opioid just in your IV, like straight into your blood, it would go to the baby and make them more depressed. So that's why you might be like, I don't want an epidural, I just want pain medicine. And it's like, well, the options for pain medicine that aren't opioids are few and not going to be as effective. So that's why the epidural is desirable over those pain medications, because it's not making it to your baby. A little bit is, but
Mm-hmm.
not very much. So you can get it, technically you can get it at any time during labor. I don't know, I've definitely heard stories where it's like, I was too far along and they wouldn't give me the epidural, or like, I wasn't far along enough, blah, blah, blah.
Mm-hmm.
Technically it can be during any time, but there is like a prime time that they're going to want to give it to you if you're already planning on getting it. They want to give it close enough to the end so that it doesn't wear off too fast and like you're still feeling numb down there. It
True.
is another downside of an epidural is you can't really walk around after you get it because you're a big fall risk. You have less feeling down there. So that could be a big downside for moms that want to be able to move and walk around and get in different positions and stuff. That definitely limits you. So that is a downside. Other risks of it, it can cause low blood pressure. It can cause headaches, backaches, nausea, fevers, difficulty urinating. If the needle that goes in goes a little too far, which sometimes that happens, then you can get a spinal headache, which can be pretty intense. And that's because the fluid is leaking out where it went too far. It can also cause a higher chance of having medical interventions, whether that's like getting your baby out with forceps or a vacuum or having to get a C-section. There is a slightly higher chance of any of those by getting an epidural. The bright side is it can be less stressful or traumatic. Sometimes births are really traumatic, and the epidural can help prevent that. So that is a bonus of that. And I mean, obviously, the main perk of an epidural is it doesn't hurt as bad. So I think everyone knows that. There's more chance that it could extend your labor sometimes, make it a little bit longer. But really, according to studies, it's only like about 30 minutes on average that it would extend your labor. So nothing really significant, but it can do that, and then thus it can make you have a higher chance of needing Pitocin, which we just talked about. So the cascade of interventions. You get the epidural, well, it can cause you to need this and need that and need that. Like, there's that cascade. So it's something to discuss or to think about. It's like I said, a little bit is passed on to the baby, which can affect their blood pressure and can affect your initial breastfeeding, but not very much. So there's definitely the downsides, and there's definitely the benefits. You have to weigh, like, how important is moving around, not getting any drugs into the baby, and then those risks of the headaches and nerve damage and things like that are a possibility with any needle going into your spine.
Yeah, that's awesome. Thank you. I will add actually a few things that I have learned. With the cascade of interventions, the stats, there are official stats saying how many more moms end up in cesarean if you do an epidural. Also, you're more likely to tear is another one, because you're so numb, your body doesn't know. I mean, when you can feel down there, there are some natural reflexes that come into play with pushing. Some will say they didn't even push. It was seriously like a reflex that their body knew what to do. But many say, oh, I was pushing, but they knew at what point to stop more if they could feel down there and not tear. Of course, this is just more likely. This isn't like you won't tear if you don't do an epidural, but and also I've heard, doesn't make it pain-free. Like Sarah said, you can't do it right when you check into the hospital. Like, you feel your first contraction and get there and take it, because you have to do it towards the end or else it'll wear off. So, which is good, because part of the labor process is important. So it's good that you don't just get numb the whole time. And then last thing, when I did my hospital tour, quite a few of the moms were saying, can't we just take pain relievers? Can't we just take aspirin? And that is something that you might hear moms do. As you said, the baby will be affected by that. So the next one I have is GBS Antibiotics. So I will say what I've learned on this. It's just so fascinating to me. So I listened to a couple podcasts on this, and I will link those because they're so good. This is another one of those things that doctors will tend to say, you're going to need antibiotics during birth or your baby could die, period. So we want to know the stats. We want to know, the downside effects of antibiotics. 20% of women will have GBS towards labor. So that means in a hospital setting, 20% of women will be told by a doctor, you're going to be administered antibiotics right now towards your birth or your baby could die, basically. But it's very, very normal. It stands for Group B strep, which I thought sounded scary, as I mentioned previously. But it's so normal. It's different when it's just colonized or when you have an infection of GBS. So those are two different things. So 20% of women have it, though. If you do a vaginal swab, very often they'll have you swab anal and vaginal and test urine. And if you do all of that, like, you literally, the chances of having it are so high because it's so normal. It's like, yeah. Then they got their yes, and now they're going to administer antibiotics. So you can opt for just a vaginal swab, usually. That's better because that's what your baby would get affected by. So approximately 50% of babies will be colonized with GBS when they are birthed vaginally. That doesn't necessarily mean that they contract an infection. So that doesn't mean they get sick. They just get that biome. Is that the right word? They get that bacteria in it. And if you know anything about probiotics and stuff, like, bacteria is not necessarily bad. We want good bacteria in us. So the chances, one baby in 2,000 pregnancies will get infected with GBS, and that is not just counting moms that tested positive for GBS. That's in all pregnancies. 70% will recover with no problem from it. 20% of those babies will recover with damage, like a disability or a long-term effect. And then that leaves 1 in every 17,000 babies die from GBS. Which to me, honestly, sounded kind of scary. I mean, 17,000 is a big number, but that is a 0.0059% chance of your baby dying from GBS. That is the official stats out there. The UK ran a study, and I could list off a bunch of numbers right now, different study, but they came up with 0.0022% of babies dying from GBS. So there is a chance out there, and I think that some people would hear that and say, scary. Some would say 0.002%, like, you've got to be kidding me. That's not even 0.1. That's like way less than 0.1%, you know. But the antibiotic, unfortunately, is not 100% effective. There's actually hardly any research done on if it always prevents the babies from getting it. Also, what's a bummer is there could be better ways for decreasing the chance of a baby getting it, but it is now in that, this happens with vaccines a lot, it is now in that category of you can't test it, because to do a study on that, it would be withholding treatment from some moms from the antibiotic, and that is simply unethical to do. So no studies currently with current policy can be done to find better ways to treat GBS. But again, most women going a more naturally minded way, like from what I've read and researched, they just give birth with GBS in their vagina, and it's not a problem at all. So you can say no to the swab. Try to say no early on in your pregnancy, because if you test positive early on, then they're just gonna see you as a GBS mom. They will try to, force the antibiotic during labor. Most women will have it, and then for whatever reason, not much studies done, but closer to labor, many women get rid of it, actually. They wouldn't test positive close to labor, so that's probably some sort of natural, like, prepping for birth thing that happens down there. So it's better to do the swab if you're going to do it close to labor, because you're more likely to get a no answer from that. But I said you don't have to do the swab, but yes, you can be declined care. So yes, you can maybe have to go find a different care source. Another thing is, unfortunately, if you get administered antibiotics, they have to be administered quite a while before you give birth to your baby, or it's not as effective. So they want to administer it at least 4 hours before you give birth. So if you try to give birth more naturally, even if you're getting an epidural, like, you're told, try to stay at home as long as possible. Try to labor at home, because they don't want you in there forever. You're more comfortable at home. You'll progress more at home. Lots of reasons. If you're researching, you'll learn that eventually, why to stay home as long as you can. So you do have to get into the hospital early to receive that antibiotic and have it be effective. Antibiotics, this one can cause a slight risk of anaphylaxis. Also, the biggest reason is it affects your microbiome, which I bet you'll talk about, Sarah. You can kind of fill in my gaps, but your microbiome is this beautiful thing. When your baby is birthed vaginally, if that can happen, obviously can't always happen, but if it can, it is a beautiful, beautiful thing. We won't go into it, but just learn about it, because it's so cool just how our bodies are created. It just gives your baby all sorts of goodness, and is why a lot of people opt to deliver vaginally, is because of this microbiome. 100% antibiotic affects it. Some people will say it'll wipe it away. Antibiotics kill the good and the bad, so that is unfortunate, and the biggest, I think, downside of antibiotics when you're giving birth. And then one last interesting thing is you will most likely be induced if your water breaks in a hospital birth if you're GBS positive. So that's just something to know and to look out for. Maybe a reason to try and not do the swab. Again, everyone will listen to those stats and hear them differently. But Sarah, is there anything you want to add to the GBS antibiotics?
You covered most of my notes. I told you earlier, but unfortunately, my dog ate my notes.
Wait, that looks like a cartoon. There are actually bite marks in the notes.
So Sadly, half my notes got eaten. But yeah, basically just the like you said, you're tested around 36 to 37 weeks is typically when you're tested, and whether you test positive or you test negative, like that's the time they take the test, and they're not doing it again. So,
Mm-hmm.
but the fact is, like, you could be negative then and be positive later. You could be positive then and negative later. That flip happens all the time, and so it's kind of arbitrary. Like, they're testing you then, and then they have no idea if you're actually going to be positive when you're delivering. They're just
Yes.
giving antibiotics no matter what. And I think at this point in society, we know unnecessary antibiotics is not good. It creates superbugs, treatment-resistant bacteria, and yada yada. So we really don't want to be getting it if we don't need it. So there's that to think about, and it does disturb your not only the baby's delivery flora, but also your body's, obviously. It can upset your digestion and your GI symptoms and stuff like that. So it's just something you don't want to take lightly. I know a lot of people do. They're like, yeah, give me antibiotics whenever I need them. And it's something we should actually be taking more time to think through and be like, oh, can my body handle this without antibiotics? Because if it can, we should do that. And but there are plenty of times antibiotics are life-saving for a lot of serious
Yeah.
things. Like, they're amazing, but let's save them for the life-saving things. Yeah, there's some various like things, taking probiotics and things like that they say can maybe help you have more chances of not testing positive. So something you can look into. It's worth a shot if you're going to get tested and you really don't want to be positive. Like, why not take some extra probiotics and see what happens? But I don't really have anything else to add.
Actually, I'm so glad you reminded me that. I currently am taking a probiotic that is specifically targeting it. Our sister Janie, she told me that she tested positive and then negative within the same pregnancy. So yeah, clearly you have it, then you don't the next day. It's wild. And she said that this probiotic is basically like for this, and I thought, hey, why not take it? You know, probiotics are great, and it's super tiny, and from here on out, I've been taking one every day for the last few weeks. So,
Cool.
um, and then just lastly on that note, I kind of shocked myself. I must have mom brain, but when I did hear that there is the slightest chance of your baby dying, I was like, oh, that's crazy. Like, wait, I don't want to be dumb, you know? Got to do what's best for baby. But always what grounds me is, okay, what are the chances of something happening to baby if we drive to the grocery store? Like, higher than 0.002%. So it's just, I always have to remember, like, what even is that percentage? That's just a number, but then you think of just life in general, and things can happen to anyone, and it's just, yeah. I'm a comparer, as I've said before, I'm a stats person, so I'm gonna go drive to the store with my baby in the car, and, you know, it's just something to have the right perspective, because even I heard that, and I said, if there is any chance of my baby dying, I should take it. But no, 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 like, you might think that, and that's okay. But when I ground myself, I realize, no, that's not true. So, let's go to the next one. This one is so fascinating to me, but the vitamin K shot, let's talk about that. Why don't you start this time, Sarah, and then I'll fill in any gaps, because I have done a lot of research on this one. But you start.
Okay, so vitamin K shot, that is given to babies right after they're born. And the purpose of that, well, if you don't know what vitamin K does for you, it's part of it's necessary for clotting, blood clotting. Okay, so the idea behind it is that it will prevent vitamin K deficiency bleeding. So the baby could bleed because they're deficient of vitamin K. The vitamin K doesn't really go through the placenta to the baby. So mom can be eating a bunch of it. It's not going to make any difference per se as when the baby's born, how much vitamin K they have or not. And they're born, they supposedly deficient in this vitamin. So they've come up with this vitamin K shot to prevent this deficiency bleeding. It is an IM shot, which means intramuscular, so they put it into the baby's muscle, And you might think, oh, it's probably like just vitamin K and saline or something like that, but there's actually several ingredients in the shot. It's primarily fat-soluble vitamin K that's derived from plants, but there's also some other ingredients. There's polysorbate 80, there's propylene glycol, there's sodium acetate anhydrous, and glacial acetic acid. These are at least in the insert, I looked up one of the vitamin K shot inserts, and that was what was listed. There might be different brands with slightly different ingredients. So those are not nothing. They're in very small amounts, but propylene glycol in a higher amount can cause seizures. So they say it's safe at this tiny dose, but we don't really know. And some of these other things too, they're not in higher doses for sure. They're not safe. Just because a tiny little dose in a tiny little baby, it can still cause harmful effects potentially. So it also has what they call the black box warning. So that is the highest warning that pharmaceutical companies can put on their inserts. And the reason it has a black box warning is that there are sometimes fatal allergic reactions that have occurred. So it's just warning you that there can be, this isn't 100% harmless, there are always risks, and one of the risks is a fatal allergic reaction to the shot. On the flip side, vitamin K deficiency bleeding is rare. I don't know if you have any stats. Let's see. I don't think I have any like we did with the...
I did write it down. 1 in 100,000 babies gets vitamin K deficiency bleeding.
Okay.
That doesn't mean that they die from it. So I actually don't have the stat on how many will die from it, but yeah.
Yeah, okay. But we'll get the bleeding. Yeah, and so the amount that dies is much smaller than that because not every baby that gets it by any means dies from it.
So that's by the way, 0.001%. Easy math.
So, as I said before, the vitamin K doesn't go through the placenta. It also doesn't go through the breast milk. So after the baby's born, you also still can't be eating a bunch of vitamin K and be like, oh, it's going to my baby, so I don't need the vitamin K shot. It doesn't go through the breast milk. So technically, the idea behind this shot is that it goes into their muscle, and supposedly it slow releases over the next several months, protecting them until they start eating food. So once they start eating food, they'll be getting vitamin K from their food. The first 6 months or so of their life, they're just drinking milk. So formula, I think they do add vitamin K to. So when you're exclusively breastfeeding, you're at higher risk. So yeah, there is the oral option. It's supposedly not as effective as the intramuscular option, which is why it's not as recommended. There's also no FDA-approved oral vitamin K drops in the US. So that doesn't mean you can't buy vitamin K drops. They're just not FDA approved. So I know like our sister Janie, she bought drops. They're just that she used for her first baby, and they're just, like I said, not FDA approved, but they're still oral vitamin K drops that do the job of vitamin K drops. So there's also the big argument against the oral, which in my research was that it requires more commitment. The vitamin K shot is one shot and then they're good for the next 6 months. The oral drops is like multiple times a week. You have to remember what if the baby spits up, then they don't actually get it. Like there's just a lot more factors that go into it. I think that's kind of a weak argument personally. For against them, like the oral seems like a good option to me, and just because it requires more commitment doesn't, I mean, maybe some moms that's a big deal, so be it. But I think it's kind of a weak argument against it. And tell us what you learned.
Yeah, I'd just say a few more things talking about circumcision because you need to know that if you're having a boy, as far as I know, most doctors in the US will absolutely not circumcise your boy if he does not get vitamin K shot. I think even the oral doesn't count. So I think if you have a girl, they'll say, okay, yeah, you can do the oral. if it's a boy. It definitely obviously depends per doctor. At different countries, I've heard vastly different things. But in the US, you have to. Doesn't mean you have to circumcise your child there. Doesn't mean you have to circumcise them at all, but that's 50% of humans, so that's wild. Definitely really fun to touch on is the fact that in the Bible, this is wild, but it says 8 days later, you should be circumcised. And the reason, if I should have mentioned, that doctors won't circumcise without it is because you're causing them to bleed and they don't have proper blood clotting abilities yet without normal levels of vitamin K yet. So when you hit 8 days of life, your vitamin K goes up. It's crazy. So it's like totally biblical. And that is so proven to be correct that even in technical medical studies, what you learn is truly babies are classified separately at 8 days specifically. And that's when their vitamin K levels change. So it's not just in the Bible, like that's very studied and scientific as well. Um, their risk of the deficiency bleeding goes way down at 8 days, all that. So, also something to know is that the dosage I learned is a normal dosage for a 200-pound man. I don't know why it's so high. So, a lot of more naturally minded midwives would tell you that's way too much and will cause issues. I will also just say some things that must not be super proven. Well, in that label, yes, it says a lot of crazy stuff. It says that there's aluminum in it. Did you mention that?
No.
So the label I've seen is that it does have aluminum in it. And then it says severe reactions, including fatalities, have also been reported following intramuscular administration, which you did say.
That's that black box warning.
That's the black box warning. And then less proven, but what you will hear if you're looking at more naturally minded resources, they will say it will up your baby's risk of leukemia, but many people will say that's absolutely not true. There was a study done and it was like not reputable or whatever. But there was a study done and linking it to leukemia. So you can look into that and see if you think it's reputable or not. But many will say that's not a good study. What was the other linkage?
Jaundice?
Yes, thank you. They say also that your baby will more likely get jaundice with a vitamin K shot. And then just also that why would God create babies vitamin K deficient? I could argue, well, we don't live in a world that is the Garden of Eden, like that is perfectly what God created. You know, there are unnatural things in our foods and in our bodies, so maybe there is something wrong with babies born. Like, I would argue against that, even though it's cute and could be true as well. Like, there could be a reason why babies should be born with less vitamin K. They shouldn't have that blood clotting ability. And I personally, like, I lean that direction. I think, yeah, there's probably a reason for it. Maybe best not to add something synthetic to your baby at birth, but you could definitely argue against that and say maybe those babies are deficient because our diets are so bad or our food these days are deficient in vitamin K or whatever. So I just hear that a lot from midwives on Instagram and all that. I'm like, okay, not the best argument, but there are some other really good arguments. I personally, I'm not going to get it or not give it to my baby because of those other ingredients that definitely have risk factor to them. My last note on it was just that your baby's risk of having vitamin K deficiency bleeding is 6 to 12 times higher if you were taking a medication as a mom for epilepsy, super specific,
Interesting.
or some other diseases. So the risk goes up. And so if you take some sort of medication during pregnancy, I would say look into it. And if it might be on the list of this increases your baby's chance of having that disease. yeah, very interesting. But that was in one of the podcasts I was listening to. And also, just really think it's interesting that a lot of midwives I've heard from are actually more for this. It's not as more for the vitamin K shot. It's not as despised in the natural community. But if you dig deep, yeah, you find not even that deep actually. I'm getting posts thrown at me every day, like why not to do the vitamin K shot. So definitely very controversial actually. And it's definitely not a vaccine, but it almost starts to seem like it when people are arguing in the comments about it. I think that's all my notes on the vitamin K shot.
Okay.
And next, the baby eye drops. I will just say it right off the bat. I know nothing about this. All I know is it's another intervention that doctors push and more naturally minded midwives say not to get. So, what can you educate us on that?
So it's actually an ointment that they put in their eyes, erythromycin eye ointment, which is an antibiotic. And the reason that they give it is to prevent ophthalmia neonatorum, also called neonatal conjunctivitis. Conjunctivitis is what we commonly refer to as pink eye. So this is neonatal pink eye, essentially. And I guess 0.03% or 0.3% of babies that get neonatal conjunctivitis can have blindness. So it's not 0.3% of babies in general get blind, just the ones that end up having this conjunctivitis.
So, there's a stat. Do you know the stat of how many
How many
contract
get
that?
it? No. Unfortunately, I did not. I was not able to find it because I did look, but I'm sure it's out there somewhere. But here's the important thing. I don't even think that's that important because how do you get this? So it is caused by gonorrhea or chlamydia, most of the cases. Okay, and the mother must have an untreated infection in order to give it to the baby. So in order for your baby to get this condition, the mom has to have untreated gonorrhea or chlamydia. Most commonly, it's chlamydia. There are some other bacteria that can cause it, but majority of cases are from gonorrhea or chlamydia. And so, if you don't have gonorrhea or chlamydia, pretty simple, the baby doesn't need to get the eye ointment. Another reason why they don't necessarily need to get it is if the baby does develop this condition and they get antibiotics for it. So if they didn't get the ointment at birth, but then they got conjunctivitis. Then they got antibiotics for the conjunctivitis. It's very low risk that they'll have any complications. Like it's pretty well treatable with antibiotics if they get it. So for those two reasons, because it can be prevented just by screening moms for gonorrhea and chlamydia and then treating them with antibiotics if they get it. Actually, it's not even recommended in several countries anymore. So we're giving it to every baby just in case here in the US. I mean, unless the mom says no, thank you. But in countries like Australia, Great Britain, Norway, these like other very developed countries, it's not like they have backwards health practices. They're no
Mm-hmm.
longer giving it prophylactically. So I think this is one of the ones that I feel really like seems pretty straightforward. If you don't want to give it to your baby and you don't have a sexually transmitted infection, which you should know, hopefully. Maybe some moms don't. There's a population that could be the case. Very well, but if you don't have those, then you don't need to be giving this ointment. Why wouldn't you want to give it? It can cause irritation to the baby's eyes. It blurs their vision and that can affect bonding right after birth. So
Mm-hmm.
those are just some kind of minor things, but hey, it's also an antibiotic. So if we can avoid giving them antibiotics and when we don't need to, like let's do it. So I don't know. I thought that was like very interesting. I also didn't know very much about it until I researched it, but it's
That
pretty
is
straightforward to me.
that is fascinating. And once again, I probably, if I had a hospital birth, would have been offered some eye drops or eye ointment very casually. if guys, if you decided you don't want this, make sure you put that in your birth plan because they're super quick. It's a very quick process. You just labored for who knows how many hours and who knows where your brain's at. So make sure, yeah, they might just do it. So make sure you have that in your birth plan. But this is just another thing that reminds me of my health beliefs these days is just if it's synthetic, if it's processed, unnatural, then I'd rather not wait till they find out later, oh, it also does this, some sort of negative effect. The chances are low, and I mean, obviously on this one, but just sounds scary when you're doing something synthetic to a not even hour-year-old baby. This just sounds like another one of those things where doctors don't want to be liable, and it's just easier and quicker for them to just do it, and your insurance gets charged and the hospital gets money. So that's what it's giving. Maybe just get screened for those two things. But sweet, pretty straightforward. And on to this might sound a little more random, but I thought we're talking ingredients. We're talking options that might not be presented as options. They might just sound like a given, but let's question things. But formula. And yes, you have options if your baby ends up in the NICU or if you cannot breastfeed for whatever reason, the hospitals will have formula there present for you. But some people actually have even been looking into, actually, I'm for sure getting it, some backup formulas in case anything happens that are better. And I can link, actually, my friend has Swedish formula and she's going to give me some because she had it as backup and didn't need it. She just gave birth. Everything went well with breastfeeding, so she's gonna give it to me. So I'm gonna have some Swedish, really all natural formula, which is really cool. But also, goat's milk is a really great alternative. They say not cow's milk, goat's milk. You can look into that on your own. And then I will link another one that you can actually purchase that we talked about in a previous episode. But those are all side notes. All I know about formula is that it has seed oils in it, and they say it legally has to. I can't remember why. Maybe you can say that, Sarah. In the US, to be called formula, it has to have seed oils in it. So take it away.
I don't know the answer to that actually.
Oh,
Why it
I'll look it up while you're
requires
talking.
why it requires vegetable oils. I just looked up the main two top brands of formula, Similac and Enfamil are kind of, I mean, if you
Mm.
picture formula, those are probably what you're picturing. The formula for the formula is supposed to really closely resemble breast milk as far as macronutrients. So how much fat it has, how much protein it has, how much sugar it has, etc. And then the vitamins and minerals in it. So they are trying to, as far as percentages go, trying to copy or mimic breast milk, but it's where they're getting these things that can be the problem. So if you buying just standard formula, it's going to be a cow's milk protein um, in the main standard formulas, unless you're buying something special like dairy free. They have soy based proteins. They have goat. You can buy formula with goat, and then they have rice too, rice protein, which like really is that like a great source of protein? But um, they are options. As far as fats go, yes, they all have seed oils, vegetable oils as their number one, well, only source of fat, um, which is very unfortunate. Um, then for sugar, they have lactose, which is, again is from milk. Unless you are buying lactose-free formula, which a lot of babies, I'm sure you've heard, are sensitive to dairy and need to be lactose-free. And unfortunately, the substitute for lactose is corn syrup. So
Oof.
you're giving your baby corn syrup, vegetable oils, and rice protein. I mean, I don't know. This just isn't sounding good. And then it's fortified with all sorts of synthetic vitamins and minerals. And then sometimes they'll throw in some prebiotics. So simple list of ingredients, simple, but not where we want our baby's nutrition to be coming from. I mean, go back and listen to your last episode on seed oils and where they
Mhm.
come from, and they're jet fuel, essentially made to into supposedly for made safe for human consumption, but they're just not meant for us to eat, and certainly not what you want to be feeding your babies.
Mhm.
So yes, there are foreign formulas that you can purchase. Um, Goat's milk is an option. And then I know our sister, she needed to feed her daughter formula because she got pregnant pretty quickly and could no longer breastfeed. So she actually, Nourishing Traditions has a recipe for formula, and it involves various ingredients that you can mix together into a formula. And it's again trying to mimic all the ratios of breast milk, but and she loved it and it worked great for her. So there are options out there. There's even a that one that she used does use milk, but there's even a lactose-free recipe in that book that the
Mhm.
babies. It's the Nourishing Traditions baby book. I don't remember.
Nourishing
It's at the
traditions. Oh, now I'm forgetting. It's such a long name of child and baby care. I talked about it on the last episode. I'm
okay,
obsessed
yeah.
with this
Well, that
book.
one
Yeah.
has recipes for formula, so there are options out there. It's obviously a little more work than taking your scoop of powder and mixing it with water, but it's worth it. It's your baby and their health. So
Cool. And I did look it up. What Google, which is now AI, unfortunately, has to say is that the vegetable oil provides essential fats and closely mimics the fatty acid profile found in breast milk. And to me, that just screams someone had a lot of money to make it illegal to not have
yeah,
in
seriously.
formula. Like, why is that a law, but Red 40 is legal? It just doesn't make sense to me. Um, and maybe you guys are wondering, what am I going to link in the show notes? We did talk about this in that seed oils episode. It's labeled as toddler formula, and that's how they get away with it. So
Oh,
you can
okay.
buy it in the
That's right.
U.S. They just don't label it as baby formula. Toddler formula makes it legal, but it is perfectly safe and amazing for infants. That's how they get away with that
Got
one.
it. Okay.
This was just a rant a mom friend was going on, but I will just say that doctors and probably what would have been me if I didn't have this mom talk about it, they normally will give up too quickly on breastfeeding, on lactation. And so we don't know. I don't know if I'm going to struggle with it. It can really be a struggle, apparently. I'm clueless. I'm like, what? What's so hard about? No, it can be really a struggle. So there are amazing strategies out there online and things you can try taking orally, teas, lots of amazing things that worked for moms to have their milk come in, to have their baby latch on. And if you're at a hospital or just didn't know and didn't research, you would maybe not know that. But often doctors will say, well, just here's formula. It's great, you know. So just know that
Also,
you can fight for it.
there are amazing people called lactation consultants.
Mm-hmm.
I know we use them all the time at the hospital I work at. So anytime a mom has any issues, their job is to come and train and help and troubleshoot and get whether it's milk supply or latching or whatever your issues are, like that's their specialty. So I think most hospitals that have a labor and delivery unit would have a lactation consultant. Definitely utilize them. Don't be afraid because like you said, it's not uncommon for moms to have questions or just feel like it's not working or maybe what if my baby's not getting enough food, like they can come and assuage all your fears. So
I love that. Yeah. And I think that formula and what baby needs in the first few months or a year of his life could be an entire episode. But I just wanted to
yeah,
talk
it's
about
true.
those ingredients and just so it's out there. Lastly, very controversial, but we'll just talk about what babies are given. in the form of vaccines. I think that each hospital has maybe like a different number. It gets confusing because some shots have multiple vaccines in them. So we're getting, and each country's different. So a lot of podcasts I like to listen to are international and they say, oh, the vaccine schedule in the first year of life is 40 vaccines. And then I heard 30 and 70. And so whatever, it's a whole dang lot of vaccines. And so, Sarah, I know you did some research on Hep B, and I thought we could just talk about that for a little bit.
B.
Well, all of it, all that you got.
Oh,
I'll probably just add a few. I don't know how this was getting brought up in my life so much, like from three different resources, and then three different people brought it up with me within 2 weeks. I was like, what is going on with vaccines? I've been doing a lot of research, just super mind blown. So I'll probably add in some stuff, but
yeah,
everything
yeah.
you had to share.
Okay. Well, as far as the number of vaccines, I went on to the CDC, Center for Disease Control, and counted how many doses of vaccines. So it's not the number of shots, because like you said, there can be multiple vaccines in one shot, but it's the number of doses of vaccines, and it's 26 in the first year, and
Okay.
then
Doses.
70 by 18 years old. So it's a lot. 26 in the first year, though, that's a lot. Basically, I just want to say that the doctor's going to be like, it's perfectly safe. Like, literally, word for word, they will say that. Perfectly
Yes.
safe. And that is not true. Like, you can't, I will say, like, vaccines, whether you're for them or not, you cannot say they're perfectly safe. There are risks to vaccines. They are not risk-free. There was the National Childhood Vaccine Injury Act of 1986 that was passed, is an act that was passed by the government, and it acknowledges that vaccines can cause injury and can cause death. There is also the Vaccine Adverse Events Reporting System, which is anytime anyone has a reaction to the vaccine that you're supposed to report it into that system, which doesn't happen as often as it can. But there's that system that again acknowledges bad things do happen from vaccines. We just don't hear about it, and we're just told that they're perfectly safe. And like you said before, they can't do studies on the vaccinated versus the unvaccinated because that would be unethical. We can't not vaccinate kids. Like every kid needs to be vaccinated. We would be putting them at risk for things that they don't need to be at risk for.
Wait, pause. I wanted that to be one of my closing notes, so I'll just say it now. Yes, it's there just the lack of studies done, not just on vaccines, but on everything we're talking about is mind blowing. And when you look into liability and laws of protection and all that, but also just this blanket statement of it is unethical to withhold treatment to someone for a study to be done. That makes sense now why there are hardly any studies done, and they're also very expensive. So it's just sad that there's studies done on a lot of things, but when it comes to women and women's health and babies, it is just so lacking. So not just vaccines, but on all these things, it's like, does vitamin K cause jaundice and like leukemia? Can't we do another study on that? Like, unfortunately, yeah, there's just not enough out there, and it's for those reasons. But anyways, continue.
They also don't have studies. Um, First of all, most of the studies are really short, like a few weeks. So anything that happens longer than that, which certainly things can take longer to develop than a few weeks,
Yeah.
they're not catching in these studies. So when they say they're perfectly safe, well, yeah, maybe they're perfectly safe for the first 2 weeks or 3 weeks, but we don't know about longer than that because we're not going to do our studies longer than that. They also don't study them in combination, like we were talking about. There's like the DTaP vaccine, which has diphtheria, tetanus, pertussis, all in one shot. And they don't do studies on combination shots. They only do them on individual shots. And so we don't know how much that the baby's getting that many at once, how safe that actually is, because they're not doing studies on it. And the person doing all these studies is the pharmaceutical companies themselves. So how trustworthy are a company that's wanting to make money on a product and they're doing their own studies? Like, I don't know. Personally, I just don't feel like that's very trustworthy. There should be a third party that's doing these studies. Um, So let's look at some of the ingredients in vaccines. This widely varies from vaccine to vaccine. So you kind of have to, I just have a general list, but you kind of have to look up each vaccine and know. But all of them have something of concern in them. So there's obviously the vaccine part of the vaccine, and then there's a bunch of other ingredients. So they're called adjuvants that are added to it, and these are what stimulate the immune response. So without these adjuvants, then you're not going to get an immune response, and the vaccine's going to be worthless. The most common adjuvant that I came up or found was aluminum, which we talked about earlier. And aluminum is a neurotoxin. It is not safe. It's not healthy for anyone to be ingesting. And sometimes they can get quite large doses of it, especially in these combination vaccines. Um, let's see, aluminum in 4 doses at 2 month checkup, because you're going to get 4 vaccines at the 2 month checkup, is 1,225 micrograms. And in another completely separate, uh, the maximum allowed in a 1 day of IV feeding is 25 micrograms. So it just doesn't make sense that on the one side, what you can get through your IV for a feeding is 25 micrograms. Any more than that is unsafe. But this 2 month old can get 1,225 micrograms at one time in through a vaccine. Like that doesn't really make any sense. They're just kind of blanketing that, oh yeah, it's safe. Aluminum's fine in small doses. But what about in these combination vaccines where it's pretty high? Other ingredients are mercury. Yes, they've gotten rid of most of the mercury in vaccines because that's well known. I think everyone knows that mercury is not very healthy. There's also formaldehyde, which is a known carcinogen, and there are yeast polysorbate or 80, which we talked about was in the vitamin K shot, and lots of other things. Another concerning thing as far as the pharmaceutical companies go is that they can't be sued. They have no liability. There's a law passed that said that they're safe from being sued. So that's like, why do they even care about making it safe? They can't be sued for it. So they're
Mm-hmm.
just in it to make the money. Um, Most of the diseases that vaccines are protecting you from are, for most of history, have been considered actually fairly benign. So, like, not that serious, or they've been pretty rare. Also, there has been studies that show that getting some of these vaccines, like measles, which is, yes, it's really contagious, but it's pretty, it was used to be a really common sickness that everyone got, and it's pretty rare to die from it. It does happen, but not very common. And it actually protects you from other diseases later in life by getting it when you're a kid. So by giving these vaccines, we're removing that protection that these some of these more benign illnesses can give us when we're kids. Um, More specifically, the hepatitis B vaccine. Should I go into that, or do you have
Yeah.
anything to say? Okay.
Yeah, I'll
Um,
just say my notes after.
okay. The hepatitis B vaccine is one that is given. It's unique because it's given to your baby within 24 hours after they're born. So your baby's born and they're immediately given a hepatitis B vaccine. Why would we do that? Again, this precious little baby that just came out of the womb, why are we immediately injecting them with a vaccine? So hepatitis B, what is it? It is a illness that can be spread by blood, bodily fluids, or sexual contact. So if a mom has a hepatitis B, she can pass it on to her baby. Um, and a lot of people can have hepatitis B and not know it. So something like 7 out of 10 people have it or don't know that they have it. So there, it could be symptomless. So that's why they're like, oh, we're just protecting these babies because mom could have this disease and not even know it and pass it on to her baby. Um, It causes in adults, it causes about 2 to 4,000, or I guess it's actually in adults and kids, 2 to 4,000 deaths every year, and about 30 to 40% of those are acquired that got the hepatitis B when they were a child. So it doesn't it is out there, but it's not that common. And it's spread again by blood and sexual contact. So what happens if you have hepatitis B? It causes liver failure and can cause liver cancer. Um, but mom can test for hepatitis B before delivery again, and if she doesn't have it, then why are we giving baby hepatitis B vaccine right after they're born? Um, they get it again at 1 to 2 months, and then they get it again at 6 to 18 months. So it's a 3-dose series. So some side effects from the shot can be fever, pain at the site, and allergic reactions and headache. So it also, like we talked about with some of the other vaccines, it has aluminum in it, which is a neurotoxin. And that's all I have to say.
Let me know if there's anything to add.
Yeah.
I did also learn that the reason they might do the hepatitis B that first day versus the other ones is because it's a 3-dose vaccine, so it just is convenient to get that started. It's not necessarily, there's not like really a better reason other than that. Also, this was going to be another one of my closing notes, but I'll say it now. We should keep in mind, which I talk about this all the time, but the hospitals get paid for each of these, right? A lot from our insurance. So the doctors, do they get a cut? Depends. Like they probably have great intentions, but the hospitals get the dollars. I've heard that's a reason why to do some of these other things like vitamin K the day of. They're like, the more likely we do it that day, the more likely it'll get done and we'll get paid. So that is just something to keep in mind. But I listened to a lot of opinions and went into vaccines in general, but I will just link a couple of my favorite podcasts in the show notes. I will say one is Joe Rogan. Um, you can have whatever opinion on Joe Rogan, but who he interviewed was Suzanne Humphreys, who was a doctor administering these vaccines at a very high level. Like she has a lot of initials before her name. She just decided unbiasedly that she wanted to do a study on the history of vaccines, and then boom, her entire life and career changed. She actually had access to reports and history and studies and decided to write a book about her findings going into the history of polio and measles, and it's a really cool book. No, I have not read it, but she talks a lot about it in the podcast, and I've heard opinions from people that read it. I want to read it so bad. It sounds so fascinating. So I just wanted to mention that because that's like an hour and a half podcast. So clearly that could be its own episode as well. And I'm definitely not going to do that because I am not this extremely highly educated doctor that has all this information and history knowledge. I'm going to link that. If you think this sounds fascinating, then check that out. But a few things that actually stood out to me, or something to know, is a lot of people say, well, why not just take it? Well, Sarah mentioned a lot of reasons. A lot of more naturally minded moms are blaming their children, or from what they've heard, having asthma, autism, ADHD because of the vaccine. They think that's on the rise. Once again, not enough studies to show it. So very easy to argue against that from anybody. But that is the concern with them. Plus, as Sarah said, you can't deny that there has been, because it's reported, seizures, death from anaphylaxis, brain inflammation, things like that. But I did also want to note, because you mentioned like measles and, oh, well, it's not really a big deal anymore. And what will so many people say? I feel like two things. One, that's because there's a vaccine. That's why it's not a big problem anymore. And then two, they'll say, do it for community immunity, like it's our deed. It is our obligation to do that for the community, whether you're low risk of receiving it, whether you're strong and healthy, things like that, whether your baby, whether it's a very prominent thing in your region or not, whether you have an STD or not, it is for the benefit of the community. So the big thing to know is that there is history and facts to show that actually the polio vaccine didn't, well, maybe this still would be attacked, but history makes it pretty obvious that the vaccine did not cure polio. Polio was very much like not a huge thing anymore when the vaccine even like came out. And so she goes into that in the podcast, and you should just watch it. But it was wild, the sanitation back in those days. And so that's just, yeah, the reason why polio was such a thing. There was like no sanitation in that era. But just all to say, like, that's my answer to those who would say it is a good deed to give these vaccines to your children, and you're not a good person if you don't. So I'm just bringing up history to speak to that. Um, and honestly, I have so many notes in front of me about it because it's so fascinating, and we just don't hear these things. But I'll just let you guys do your own research on it. And I will say that if you don't know yet, or you don't know already, there really has been an awakening on this recently. And you just might not be seeing it in your area, in your community, but it's just something to, yeah, look into the ingredients on, the side effects, and we're here to tell you that. I feel like you could be in a community that says don't question it, and so we're just giving you the freedom to question it and do your own research on it. There really has been an awakening since COVID, and since some things have been coming up on that, and so it's worth looking into for sure.
I
And all that.
think for me, just to sum it all up, back to what we said at the beginning, whatever you end up deciding, understand that there are really valid arguments on both sides of all these topics. And we just want you to be informed why some people choose one way or the other and respect that and know that there's a really good reasons for it. And like we can all learn from each other and let's like find the answer. Like rather like let's not just be so like create so much anger between people, but be like, oh, like these people are concerned, they have a valid reason to be concerned, like let's figure that out and like let's find a better way. We're smart. It's the 2025. Like if this isn't working and it's causing harm, like let's figure it out and do something better. Like I think we can have really a lot more productive arguments than currently where it's just like butting heads and like you must be absolutely wrong and like no, I think everyone has a reason for the decisions they've made. Let's hopefully they based on facts and data and not just opinions and people's desire to be
Emotions.
right. Yes, emotions.
Desire to
Thank
be
you.
right, stubbornness, emotion. Um, Also, that one person you know, or that one story you heard, no, look into the facts and the stats, and do your own research for sure. Don't just do what your mom told you to do or your neighbor, you know.
Hmm.
Um, yeah, thanks. That's a really good point, and I feel like we should be saying some liability things. We're not giving you medical
Yeah.
advice.
We are not doctors. Make your
We are
make your own
not
decisions.
doctors. Sarah's a
Steer a
nurse.
doctor.
Nurse, not a doctor. Yeah. So don't just take it from us. Definitely do your own research. But now you have a taste, and just, man, I was getting really passionate thinking about this episode and wanting to like rant or be more sassy on some things, but really the truth is like, no, if we can just plant seeds and get you to do your own research, that's really the desire. Because what I really am passionate about and upset about is the fact that doctors don't give this information when they should. Um, or nurses. I'm not mad at moms, no matter what they choose. And there's so many reasons they might choose one way or the other, and that is like, why would I ever be mad at them for just doing what they want for their baby, what they think is best? It's more just like, I'm mad that this information is not given to every single pregnant woman that steps foot into a doctor's appointment. We covered everything I had written, and if more comes up, I'll probably talk about in future episodes if I hear of maybe more suggested medicines or vitamins. But that, I believe, is the gist of what you will be pressured to do. And I don't think I have any more closing notes. What about you,
Cool.
Sarah?
I don't think so.
Yeah. Thanks for listening, guys. My mind has been blown by everything I've been learning lately, and I can't wait to keep learning and keep sharing. And thank you so much for being on, Sarah, and taking the time. I'm sure you're tired from work, so we appreciate you a lot.
Thanks for having me.
Yeah, and we'll chat next time. Bye, guys.